Like there was the announcement this week, the autism announcement. It wasn't Tylenol causes autism. Like that's what the media skewed it to. Tylenol causes autism. No, it didn't. No one ever said that. It said Tylenol links or is associated with neurodevelopmental disorders in pregnancy. That's like the verbiage is huge and it's a big difference because there's so many contributing factors to every single condition.
Hello and welcome back to another episode of the Birth Lounge podcast. Welcome back, you guys. I want to share a little personal story. So I was just waking up last week and one of my really good friends who's also pregnant, it's been so much fun being pregnant with her, she texts me and she goes, oh shit, I am 34 weeks and I realize I have nothing to ask my provider. I really don't know what I should be talking to them about in today's appointment. And I quickly texted her back and said, download the Birth Lounge app and go to 34 weeks and it will tell you what is going on with your baby and what you should be asking your provider. Then she texted me and was like, when is my GBS test? And I said, it's probably in the next couple of weeks. And she said, what questions should I ask about that? And I said, download the Birth Lounge app, go to GBS, and it will give you all of the questions that you should ask. And then she said, should I tell them about the Braxton Hicks that I've been having? And I said, yes. And she said, what else should I be asking? And I said, go download the Birth Lounge app, girlfriend, and it will give you all of the questions that you need to ask. So my advice to you is if you're sitting in your prenatal appointments right outside in the lobby and you're thinking to yourself, what am I going to talk about today? Am I just going to walk in there and let them fill the 5 to 8 minutes I have with them with the things that they want to talk about and walk out feeling like, what was the point of that? Then let me stop you right in your tracks. I want to give you some control back in that conversation. I want to equip you for the things that you can truly ask your provider to make sure that not only are you getting evidence-based care, but are you truly matched with the right provider? Are you having the discussions that you need to be having leading up to your birth? Are you asking all of the questions about what to expect in labor from your hospital that are based on their particular protocols? Because if you didn't know, every hospital kind of has their own protocols and policies. So if you're at hospital A, they're going to have certain policies and protocols. Hospital B will be a little different, and then hospital C might be drastically different from even those two hospitals. And so I always think it's a great idea to know exactly what you're walking into when you get into the hospital having your baby. But these are not discussions that you want to do while you're in labor. These are the discussions you want to have leading up to your labor in those weeks before you go into labor. The Birth Lounge app will not only teach you what is going on with your baby and your body every single week, but it will also give you evidence-based information and the questions that you should ask about all the topics that you need to be discussing with your provider before you go in to have your baby. So go to your respective app store, whether that's Android or iPhone, type in the Birth Lounge app, and you'll see it right there. Download it to your phone. Start to go through it as you are in bed and having that nudge to scroll. So instead of scrolling social media, that typically gives us anxiety, you can instead scroll in the Birth Lounge app. That will not give you anxiety. It will give you evidence-based information. It will give you confidence. It will help you be informed. And dare I say, it might even make you excited to have your baby. I want you to have the absolute best birth possible, and I'm not going to toot my own horn, but what I will say is I know how to get you there. I've been doing this for 10 years. I have seen thousands of births, and I have seen so many women before you have their dream birth. And I'm following this same exact approach in my own pregnancy, and it has been so joyous. I'm genuinely so stoked to give birth. And I want to share that with you because I want you to feel the same joyous feelings. Head to your app store and download the Birth Lounge app today. See you there. All right, remember when the COVID vaccine was emergency use authorization and we just kind of went for it, and we knew that we had to get it out fast because people were looking for a remedy. They were looking for a way to keep themselves safe. Well, this is my version of an emergency use authorization podcast episode. I wanted to get you transparent, evidence-based, no fear-based language, no coercive care, just truly transparent conversation with a respected medical professional, a pharmacist, on what you need to be thinking about when you are taking acetaminophen in pregnancy. I know that so many of you are feeling really unsure and scared and confused right now. I know this because my inbox is filled with literally hundreds of you, and I literally mean hundreds. I could not get to all of your questions and your DMs and your emails if I was an octopus and I had 8 arms and legs. I don't think I could do it if I had 20 arms and legs. There are so many of you with such good questions, and so I wanted to put it all in a place where anybody can listen. Not only can you listen, but you can share it with your partner, you can share it with your boomer parents, you can share it with your neighbor, you can share it with the girlfriends, and in the group chat where all of you are wondering, what the heck do we do? Is Tylenol safe? Is it going to give my child autism? Am I making the wrong choice? And who the heck do I turn to for answers? I know firsthand how easy it is to spiral when every time you open up any app at all on your phone, you are bombarded with all of this information. Some of it saying that it's highly dangerous, some of it saying it's 100% true, and you literally have no idea how to decipher between the two. Today, I'm super stoked to be being joined by Dr. Michaela Wachal, who is a clinical pharmacist. She's also a clinical accreditation manager with the expertise in specialty pharmacy, and her drive is to improve patient care and outcomes through maximizing patient care, overall well-being, and mental health. Plus, she focuses on personal growth, healthcare optimization, cost savings, drug pipeline research, and neurodiversity. Michaela is actually a mom of 3, and one of her children is on the autism spectrum. She is a self-proclaimed complete nerd and says that she absolutely loves research, advocating for people, and educating other parents. When I found Michaela's Instagram page, I was instantly drawn in because she not only presents things very factually and non-biased. She's not trying to push a certain agenda, and she gives you all the data that you need to make your decision. I also love how she equips you to ask questions to your provider as you're navigating these decisions. Does it sound familiar? Honestly, the more I dug into her Instagram page, I was like, oh my God, she's the HeHe of the pharmacy world. So no lie, you guys, I literally reached out to her, asked her to be on the show. She said yes, and we sat down to record less than 48 hours later. Hence the emergency use authorization energy of this episode. Today, Dr. Wachal and I are going to dive into, when it comes to medications in pregnancy, where are the biggest failures of the pharmaceutical industry and the medical community? Just because something has been proven to quote unquote show no harm, does that automatically mean that we can assume it is safe? How do toxins, glutathione, and dosing of acetaminophen play into the possible association between acetaminophen use and ASD, autism spectrum disorder. The biggest thing that I find missing from the conversation right now is nuance. All I see online is that Tylenol either causes autism or it absolutely doesn't, and it's safe to take. And I think that neither one of those are 100% true. I actually believe, which is the norm around here, is that most of us live somewhere in the middle. And I believe the answer lies somewhere in the middle. Is there an association between acetaminophen use and low levels of glutathione and ASD? Possibly. We need more research. Is it true that acetaminophen is 1,000% safe no matter who you are at whatever the max dosage on the back of the bottle is? Probably not. In a world where everyone's genetics are so different, all of our toxin loads are so different, everyone's pregnancy is so different, I don't believe in too much black or white thinking. I think a lot of our answers lie in that gray space, and that's exactly what Michaela and I are bringing to the conversation today. Some gentle nuance to help you explore what your options are when it comes to acetaminophen use in pregnancy, the risks, the benefits, and what you need to consider. So without further ado, Dr. Wachal, welcome to the show.
Hi, thank you so much for having me. I am so excited to be here.
You have no idea how excited I am. And I already told everybody that I reached out to you and I was like, can you record with me? Can we do it like literally tomorrow? And can we talk about these things? And so I'm really appreciative of your flexibility. I'm so grateful for the education that you're doing online. Honestly, the algorithm just fed me one of your videos and I thought, wow, this is interesting. And I clicked on it and then I was consumed. Honestly, I was like, this is what everyone needs because I found that not only were you presenting things in a neutral way, which is exactly what I try and do as well, but you were genuinely talking about data points that nobody is talking about. And I think that's what I would like the takeaway from this episode to be. We have this massive problem right now in the US that everything gets conflated. Right now, the conversation that people are having is Tylenol either yes, it causes autism or no, it doesn't, and it's 100% safe. And one thing that I love about you is that you have shared nothing is 100% safe. There's risk with every choice, right? And that's something I say all the time as well. And so let's start there. When it comes to medications in pregnancy, where do you think that the pharmaceutical industry and the medical community have failed women?
Oh gosh, this comes down to taking a reactive approach rather than a proactive approach. Okay, so we tend to give these medications and then or say they're safe and not know what harm they may cause until they cause the harm and it's very evident, and then we go back and say, oh yeah, this is the reason. So if you think of thalidomide for an example, we were told it was safe in pregnancy, but then we have all these birth defects from it. Now it has all these REMS programs that so when you're handling the medication, you have to take special precautions. Anyone getting the medication has to have special precautions. If they're around anyone that could potentially get pregnant, there's a whole safety net around it because of the dangers that it can impose. Okay, so that's just one example. I mean, but this is happening where we're saying this medications are safe to pregnant women, and we're not considering the full risks. We're not actually looking at, yeah, but we don't know that it is safe. We don't know that it's not proven safe. We may not have evidence that it's not proven harmful, but we don't have the evidence that's proven safe. So how can we say that it is safe in pregnancy? And so we have these studies that we will go off of, or like different medications are given different risk categories. So you have like category A, B, C, and that's usually based off animal studies. So because we don't have studies in humans, because it would be unethical to give a pregnant woman a medication, right? We don't know if it's going to cause harm and then see what happens like that. So we don't do that. But animal studies will sometimes have those to say, oh, yes, this caused harm in an animal model, so we don't want to use that. Or there's no evidence of harm in animals. And so we can go off of that sometimes. But really, it's that we've minimized the potential risks of medications in pregnancy, like acetaminophen, making it seem like, oh yeah, it's safe in pregnancy, just take it. Pain, mild aches and pains. But no, you're pregnant and you want to do the best job possible to care for that baby, to develop that baby. I mean, any mom wants that. And I would always way rather have had any warnings, any risks, and known those up front than just not been told and actually be told that it's completely safe. So the transparency there, we need full transparency, and moms deserve that because moms deserve to be given that information so they can make the best decisions for raising that baby, for growing that baby. So it's really frustrating actually from a pharmacist standpoint and a mom standpoint. So I also have a child with autism and ADHD. And so that's what led me to all this research. I mean, for 8 years, I have been researching nonstop to how to best help my child. And when I kind of woke up, and this is because I went through the medication route because I thought that was best at the time, where we were on antipsychotics. It was 10 different stimulants. It was anti-anxiety meds. And I got to a point where we didn't know what medications were causing what side effects, what was helping. It was so all over the place. And it was just throwing med one after the other. But it just got so out of control. And I said, we don't even know how some of these medications work. My child's being a guinea pig. Like he's just being a guinea pig for these medications. And he had extreme emotional dysregulation and aggression and things like that, where I said, that's enough. Like that is it. I'm going to get him off these medications. And I did one by one, got him off everything. This was less than a year ago. Today, he is he's a different child. He is, sorry, I'm gonna get emotional because it's hard to think back where you were a year ago, to think that you were in that place of, I was in fight and flight every day. It was extremely stressful and traumatic for my entire family and my son. So just knowing that where we are now, and he's like a typical kid, he's like a typical developing kid. We have educational gaps that we're working on. But if I would have kept going the route that we were going with medications, he would have probably ended up in a psychiatric institution. Like that is, I'm saying this because I don't think people understand the severity of it and how it does affect families and his siblings. I was keeping his siblings safe. I was keeping myself safe. And I never wanted to talk about it because I never wanted that to be on him. But now I realize, no, it's not on him. It was never on him because he was trapped inside this body that just took over. And it wasn't him when he was having extreme meltdowns, and anyone that knows him well would know that. But so to see him to be the person that he is already today and the progress we're having, that's why I'm doing what I'm doing. Because I was doing this research and I'm like, why am I not sharing this with everyone else that could potentially benefit? Because I have a medical background. I can speak the health lingo. I can speak with the physicians, but so many can't. Like it's complicated stuff. You can't talk to the physicians. You can't advocate when you don't know that language. And then you don't have the resources. People don't have money to do all these therapies and don't even spend money on medication, for instance, or supplements, or see a functional doctor. So I just feel for all these kids and all these families so much, and it gets me going. And so that's why I fight every day. Even though my child is doing really well now, there's still so much we don't know. So I'm constantly researching. I'm constantly trying to figure out those mechanisms. And as a pharmacist, that's what I like. I like mechanisms, like how things work in the body, understanding why things work the way they work. And so that's what I really started focusing on. And it was just, once you start on kind of on that rabbit hole, it keeps going. It keeps going. And so getting back to your point, I'm sorry, that was a big circle there, big circle. Yeah, I just think everyone that's pregnant or going to become pregnant or moms deserve full transparency. And that means being honest about how these medications potentially work or the potential harms that they may cause. And a lot of times there's the arguments of the studies that we have that say there's either an association or there's not an association. But we need to look past that too, and also realize that if there's any evidence of any harm, why would we ignore that? Why would you ignore that we have evidence of associating neurodevelopmental disorders to that? But what people are missing is that For instance, like there was the announcement this week, that autism announcement from Trump. It wasn't Tylenol causes autism. Like that's what the media skewed it to. Tylenol causes autism. No, it didn't. No one ever said that. It said Tylenol links or is associated with neurodevelopmental disorders in pregnancy. That's like the verbiage is huge and it's a big difference because there's so many contributing factors to every single condition. So if you think of just like any health condition, when you look it up of causes, you're going to get genetics, you're going to get environmental factors, you're going to get lifestyle. All of these impact health conditions, like your chances of developing or getting these health conditions. It's no different here. Like autism is not different in that sense. And so people will say, oh, it's genetics. It's just purely genetic. Clearly not, because we wouldn't be at the rate we are right now with 1 in 32 children and seeing that quick of a increase. So we know that there's something else going on. And so that's why I started looking at other contributing factors. The toxins that we come into contact with every single day, that's not the amount of toxins that we were exposed to 10 years ago, 20 years ago. That's constantly changing, and those have an impact or can have an impact. And I think a big contributor of what's being missed. But with the Tylenol, there's the link is, okay, so if you look at the mechanisms of why it is potentially unsafe. Okay, let's talk, you want to talk about that? I know, I'm just kind of going. So Tylenol or acetaminophen depletes glutathione. So glutathione, for those that don't know that, what that is, that's our master antioxidant. So we need that to detox, to basically like neutralize toxins and get rid of them in our bodies. If you max that out or don't have enough of it, then those toxins, you don't get rid of them. They accumulate. And then when they accumulate in your body, they can cause damage depending on where they accumulate. So if you have toxins accumulating in your brain, then you can have inflammation and oxidative stress, mitochondrial dysfunction, things that we see in autism. So it's a bigger picture that people are thinking about. It's Tylenol being a contributing factor because it's lowering your ability to detox toxins that you may come in contact with. So now if you take Tylenol, let's say in pregnancy, and the other thing is, depending on where in that pregnancy you take it, because we don't understand fetal development fully. We don't understand fetal enzyme development fully. And so when you're figuring out the pharmacokinetics of any drug, you look at absorption, distribution, metabolism, and excretion. Well, how do we know that for a fetus when we don't fully understand that? When we don't know the enzymes in the fetus, we don't understand when those are developed and if they're fully present, or there's a certain enzyme that's not fully present until like 20 weeks after pregnancy.
Wow.
So if they don't have those enzymes, then how are they getting metabolizing that drug? Like, I just don't understand sometimes why we're missing this. When we don't fully understand fetal development, we can't say something is safe because we don't know how it's working. We don't know what it's affecting. But if a fetus can't get rid of that toxic metabolite, it's NAPQI from acetaminophen, and it's depleting their glutathione, now they're kind of defenseless against any other toxins that they're coming in contact with. And when do we usually give Tylenol? We give it after vaccines. And anyone that's stayed up with vaccines will know, and this was very eye-opening for me. I just say, in pharmacy school, I was not taught about inactive ingredients in vaccines. Okay, wow. I know. So that's kind of what started this all too, because I found out aluminum is in vaccines. It's a neurotoxin. I mean, you can look it up on PubMed. There's like thousands of studies about aluminum being a neurotoxic substance. It's a neurotoxin. It's very well known. Like, you just Google it, aluminum's a neurotoxin. Okay, so then we have people saying, why is it in vaccines? It's there to increase the immune response as an adjuvant. Okay, but then when you look into it and dive into it further, it's given intramuscularly, it's still getting into the bloodstream. Whereas when you take it, when you're eating something with aluminum or you're drinking it, oral ingestion, it has to go through like that first pass metabolism. Okay, and so the bioavailability, or how much is getting into the blood from oral ingestion, is like 0.3%. I don't know exactly, I think it's 0.3%, around there. Okay. But when you get something intramuscularly, it's almost 100% getting into your blood. It may not be at all at one time. It's because it's meant to be a slow depot, like a slow absorbent, but gradually it's getting into your blood. Okay. And when aluminum is bound to different salt formulations, like aluminum hydroxide, they dissociate though, and then you have the aluminum ions that bind to a transferrin and citrate in your blood, and that gets carried throughout your body. So we don't completely and fully understand those mechanisms yet. I think there's a lot of research and stuff to be done there. But we know that it's getting into your blood, and we know that it accumulates in tissues. And there's studies showing that aluminum is present in the brains of a lot of different conditions: Alzheimer's, multiple sclerosis, autism spectrum disorder. So another part of what I've been doing is trying to, when I read these studies and I find that certain scientists have done a lot of research in certain areas, so I've been trying to reach out to them and interview them. And so I have done that for one, and I have another one coming up. But because there's scientists that have researched these types of things for 40 years, they've dedicated their life to it. And it's real science. I mean, this is good science. It's not pharma backed. It's very helpful and insightful. And so people don't read studies because they're like complicated to read. And so I've been trying to go get them more exposed, because it's their life work that is so informational that we can use. And so what I found is a lot of times we have the studies with different information, and we need, like, if you put them together, we have answers to a lot of things. So, you know, roundabout story there. Got to vaccines and from Tylenol, but that was the connection with Tylenol, is that when you're giving it after vaccines, and when you have a lower defense where you can't remove those toxins, now those toxins have a chance to accumulate and cause damage. And then that's not considering all the other toxins that we're exposed to every day. So it's not saying that it's just toxins from vaccines, all the toxins, glyphosate, it's heavy metals maybe in water and things like that. So it's very multifactorial, and I think people are missing that. Like, we're putting so much emphasis on one thing. It's never one thing, but if you know a contributing factor, why wouldn't you eliminate that? Like, why wouldn't you remove that potential contributor, that risk, and help yourself, like help us out?
Or at least be very honest with moms about the risk that they're taking. First, I want to say that your son is so lucky to have you, and that you are a phenomenal mom. And I hope that you realize and have so much pride in what you have done for your son and how you have truly changed his life. And I know that is really hard as a mom. And I know that you probably had the double weight of being a pharmacist and at one point in your life being very indoctrinated in this pharmaceutical and medical world. And that caused you to have to break away from part of your identity. And I recognize that fully. And I want to hold space for that, because I know how hard that is. And you are just a really great mom. Second, I want to say thank you for sharing this with all of us, because these are the conversations that a lot of us are desiring, and we're not getting them. We are either getting the total anti or the total pro, and that's not where most of us live. Most of us live in the middle, where we want to talk about the risk and we want to talk about the benefits, and then we would like the people around us to just leave it up to us to make the best decision for us. So thank you for that. The next thing is, you talk about moms deserve this information. Yeah, that's part of informed consent. Like, if your provider is simply just saying, like, take Tylenol, it's safe, and you're like, okay, but what are the risks? And they're like, oh, it's 100% safe. That is not informed consent. It's just not. It is them saying, regurgitating what they have been told for months, years, decades in the past, but that's not true informed consent. If anybody ever tells you something is 100% safe or absolutely zero risk, you know that's a lie. That those
Right.
things don't exist. Those two ends of the spectrum are impossible to achieve. There is nothing in life, getting in your car, going to sleep at night, drinking
Yeah.
water, like nothing comes with 0% risk or
Yeah.
100% guarantee of safety. And so I just really want to hone in on that for our listeners and remind people that if you have a provider who is pushing you with the language of 100% safe or there is zero risk, really sit with that.
Yeah.
Either push back on that and ask more questions or recognize this is not a provider who is either using critical thinking or willing to go there in a conversation with you. And you have to decide whether you're okay with that in your healthcare. So,
Right.
this has led me to a question that I have asked for many years, and I ask it about every single thing that comes across my desk. Just because a medicine has not been shown to cause harm. So, quote unquote, there's no harm shown, right? We haven't discovered any harm that it does. Can we then say that it's safe? In my opinion, no, because data's always changing. New studies are always coming out. Medicine's always changing. I mean, shoot, we used to tell women it was safe to smoke cigarettes in pregnancy until we realized, oh crap, that's not
Yeah.
very safe. We should
Very good.
redact that. We should retract that recommendation. So it's like, just because at this point we don't know that there's no harm, that is not like simultaneously meaning it is safe. It means right now with
Exactly.
data that we have, we don't have any known harm. Is that right?
Yeah.
Or what's your
Yeah.
opinion on
You
that
no,
as a
you're exactly right. And the thing is, this has never changed. Like that practice has never changed with, or it shouldn't have. It's just how it's being communicated. And that's what's so upsetting, I feel like, with this. And then it's becoming politicized, where it's like this is about keeping babies and moms safe. Like ignore anything else. Let's talk about the evidence that we have, and let's just talk about the mechanisms and why it may not potentially be safe. And then minimize the use of it. It's not saying if you absolutely need it because you have a high fever and the risk outweighs the benefit, that's a situation, yes, then you may need it. But you also want to take the lowest effective dose, okay, not just the full adult recommended dose. And then the dosing thing is a whole nother discussion too, because so I'm going to bring up American Journal of Obstetrics and Gynecology published in, I think, in 2017 that acetaminophen is found in similar levels in the fetus as in the mom's blood. Similar levels. Okay, now think about the dose that a mom gets. A mom takes the full recommended adult dose. Do you know how much higher that is than an infant dose we would give? That's weight based. And yet the fetus is exposed to that. That alone to me is just such a red flag that we have been completely ignorant. Like, we're not thinking. We're going off of guidelines, following those recommendations, and then we trust those. But we don't. Those people making those guidelines are people. So what are they looking at? Are they considering fetal development? Are they just looking off of studies that we have? So we need so much better transparency. We need so much more going into these recommendations that everyone just blindly follows. And then I think what's also important to consider is that anyone in healthcare, it's going to be super hard for them to accept this. And that's what we're seeing, because it's something that we've practiced their entire lives, or most of their lives is, oh, Tylenol's safe. Yep, you can take it up to the recommended dose or adult dose every day. And they don't think twice about it. And so to also admit that you may have been wrong and that you may have caused harm to all these potential, like that's gonna be a lot.
Yeah.
And then you went to school 7, 8+ years, dedicated your life, your money. I mean, this is our health. They're not bad people. I mean, we're not bad people. It's good people not being given full truth and transparency, being told a certain narrative, not utilizing critical thinking rather than following guidelines that they trusted. So it's just we're in such a tough time. Like it's a tough time to be pregnant. It's a tough time for moms, especially because if there is good guidance, so they don't know if to trust it or not, and they just want to protect their baby. Yeah. So I see this as in 5 years, looking back. Yep. Why did we do that? Why did we ever say just brush it off? Tylenol was safe. And what's funny to me is there's not funny, but like there's even Tylenol, like things going around, like Tylenol in 2013 around there even said, yeah, we don't recommend it in pregnancy. I think in one of the guidelines or recommending bodies then said, yeah, you want to caution the use. And now are saying, oh yes, they're backing that they say it's safe in pregnancy. Like it's so politicized, and I don't understand like why are we politicizing something around protecting a baby? It's just almost sickening, and I don't blame any like physicians or anyone because the way I thought a year ago from where I think now is so much different. Because if you don't go looking for things, then if I didn't have a child that I needed to protect and do this research for and look into, I would have been a pharmacist promoting vaccines probably still today. And it's just you change what you get exposed to, the information you're introduced to changes your views. And I just encourage everybody to be open-minded and to question, because we have lost that. We've lost the acceptance of questioning things. Like if you question something, it's terrible. Like, why would you do that? Why would you? No, like that should be normal. We should want to question. That's when the best discoveries happen. That's how discoveries happen. So I'm so glad it's as hard as this time is I will say for any probably autism moms, this week has been incredible because it's for me the first time I feel like I'm not fighting alone. I'm like everyone's waking up to the fact that this is a real thing. This is affecting so many moms, so many families. And people are now understanding and are asking questions and are being curious and wanting to know. And so it's nice because you feel in this journey, like in the journey I've had and that my family has had and the most millions of other families, it's very lonely. Yeah. So I'm so happy for that. And that's why I tried to step up in what I'm doing, because I want to advocate and I want to educate, because I think I really do. I think it's going to take a lot of people to help everyone understand what's going on, what mechanisms are happening, certain things to happen. And people just want these answers. They just want it to be like, oh yes, it's genetics. No, that's just not how it works. It's not. But we can work together. We can use what we have. We can do the studies. And I'm very confident that we can get there and provide kids help to these families. So yeah, again, got way off topic there.
Yeah, I am someone who, for the last decade, I've been encouraging people to ask questions. I love questioning things. I think that questioning businesses and healthcare and decisions that we're making and our government, this is the way that we improve our world. If you see a business that's not doing something right, ask questions. If you are someone who thinks you can do it better, ask, how can I do this better? How can I start a business? If you see our government taking advantage of people, ask, why are we seeing this? What can we do to change this? How have we gotten here? How are we allowing this to happen? Same thing with your healthcare, right? As I'm always asking people to ask questions. Why do I need this? Is this based on my individual symptoms? Have you considered my personal health history, or is this a blanket standard of care recommendation? What is my relative versus absolute risk? What are my alternatives? Like, we need to be asking questions. And so I was going to say secretly, but it's no secret. I love where we are right now. I love that people are asking questions. I love that big organizations and industries are being held accountable. I love that we are starting to demand better. And as the American people, we are starting to say, no, wait a minute. I'm not going to just take this because someone with a white coat or someone with 17 letters behind their name or someone with a huge title says that I should, right? Like, I love where we are right now. I love to think about what our world
Yeah.
is going to look like in the future when these big industries and these big organizations have accountability. They no longer have immunity to harm the American people without any sort of repercussion. And they actually are working for us again because I know that's how they started. I know they got started because the American people deserve to have organizations protecting them, but we've gotten so far off the beaten path that is no longer the thing, and corruption is just everywhere. I mean, you basically can't look anywhere, left, up and down, behind and forward, that without finding corruption. And I am so ready for a future where that does not happen. Y'all, I am deep into nesting, and there's something so primal, so instinctual about this phase of pregnancy. One minute I'm alphabetizing baby clothes, and the next minute I'm deep cleaning baseboards at 2 a.m. It's not just about getting your nursery ready, it's about creating a space where you feel safe, calm, and held as you prepare to bring your baby earthside. Nesting is just as much about preparing your body and mind as it is preparing your home, and that's exactly where Cozy Earth comes in. Because while you're pouring love into every corner of your home, Cozy Earth helps pour that same energy into you. Their bamboo sheets, loungewear, and pajamas turn your bedroom and really your whole life into a nesting sanctuary, a soft, serene retreat where you can go deep within yourself to get ready to welcome your little bundle of joy. Let's start with their sheets. Cooling, breathable, and buttery soft. So whether you're pregnant and tossing and turning through those hormone-fueled nights, or you're postpartum and grab and rest where you can, these sheets make even a 30-minute nap feel like a luxury. It's like a deep sigh woven into the fabric. And I also love that you can try them completely risk-free with their 100-night trial, and they come with a 10-year warranty. Now add in their loungewear to the mix. Stretchy enough for a growing bump, soft enough for your delicate postpartum skin, and cute enough that you will feel like yourself in between each of these phases. These pieces move with your body, offering comfort that doesn't just feel good physically, but emotionally too. I can throw on one of their loungewear sets and feel totally put together, even though I probably haven't showered in several days. Finally, their pajama sets, the absolute softest PJs that you will ever feel, plus temperature regulating to keep you cool and sustainably made so that you can sleep while knowing that you aren't putting microplastics on your healing body or exposing your newborn baby to chemicals when you snuggle. Plus, they open in the front, which is perfect for feeding your sweet little one. I have 5 pair of their PJs and I plan to live in them postpartum. Nesting isn't just about preparing a crib and folding onesies. It's about building a cocoon for your baby, sure, but also for you, a place to rest, to soften, to be held, to grow into your new role as a mom. Use code HeHe for 20% off your nesting essentials at CozyEarth.com. Because while you're preparing for everyone else, let Cozy Earth prepare something soft, soothing, and sacred for you. Visit CozyEarth.com and use code HeHe for 20% off. Now, you touch on a good point. Fevers, because we do know that if in pregnancy you have an unresolved or untreated fever, there are some pretty serious risks to mom and baby. Tylenol is one of the things that can help. It is probably the number one recommended thing. And if that feels good to you and you feel safe doing that, definitely do that. But for people who are like, okay, now I feel really nervous because I don't feel comfortable with Tylenol, and what if I get a fever? As a pharmacist, what are some other options that parents have to treat a fever in pregnancy? Or is Tylenol really kind of our best bet? And in that case, it is like the benefits outweigh the risk.
Now I will say I haven't looked into specifically like homeopathic options that there
Okay.
are. I know those are probably out there. I haven't
Yeah.
delved into that yet. But I will say one question I have, or I thought of, is we have something that we give when there's a Tylenol overdose or acetaminophen overdose because it's tough on the liver. So most people don't realize that Tylenol is tough on the liver, so it can cause hepatotoxicity. And there's actually a warning. FDA requires a warning on prescriptions, and then OTC has a warning for liver damage. And so that's why you don't want to go over the recommended dose. That's tough on your liver. And actually, if you're taking, like, think of someone drinking alcohol and then someone taking Tylenol with it, it's like a double whammy. They're depleting that glutathione in two ways and more likely to cause liver damage because then you have oxidative stress that affects the cells. So that to me is like, why aren't we even questioning that in pregnancy? Like it should warrant caution, just knowing that. But there's something called N-acetylcysteine or NAC that we give acetylcysteine that's FDA approved for acetaminophen overdose. So if someone comes in with a Tylenol overdose, you get acetylcysteine because it supports glutathione and it binds or it inhibits that NAPQI, that toxic enzyme. So it does that directly, and then it also supports glutathione to help detox. And I mean, that's FDA approved. It's acetylcysteine. So to me, I'm thinking, why are we not looking at N-acetylcysteine to give if a pregnant woman really needs to take Tylenol for fever? Why wouldn't we give that to support glutathione levels and help with those toxins? So that's kind of ahead of our time. Maybe in the future that'll be looked at and it'll be added as an indication for acetaminophen-induced hepatotoxicity in pregnancy, or just acetaminophen use in pregnancy, to give that with it. So I think that's just something I've thought about, because sometimes we have to look at like all the tools that we have and see, figure out solutions. I think we are capable of figuring out those solutions for pregnant moms when they need those high fevers, or at least figuring out a way to minimize the risk. But I do also want to say that Tylenol, that's not the only thing that decreases glutathione. And it really comes back to just care for mom. I feel like when you're pregnant, you're just expected to go on with your daily life and just do all the things where our society is so go, go, go. It's so busy. It's keep up with everything. It's just nonstop. But I think we really need to focus on taking care of mom when they're pregnant, and emphasize that and prioritize that. And moms realizing that it's okay to take care of myself. Like, it's okay. I need to prioritize that during this time, especially focusing on just stress reduction, because if you have higher stress, that depletes glutathione, that lowers your glutathione level. So focusing on stress reduction, whatever that is that works for you. Is that going for a walk? Is that deep breathing? Is that mindfulness? And mindfulness, I didn't even know what mindfulness was until this last year, until I did a parenting class for my child. And I'm just like, oh my, like, just simple things like that. Like mindfulness, it's great. You just being aware, just listening to your body. So there's always things we can be doing and learning just to be better. And then when you're pregnant, just making sure you're getting nutrition, that you're eating for nutrition. You're getting plenty of protein, you're drinking plenty of water, getting the vitamins and minerals that you need to support that baby, that fetus. So there's just so many things I feel like we could do better just as a society all around pregnancy and supporting moms and helping development of the fetus.
So just to clarify, are there any other things other than what did you call the?
Oh, NAC.
Yeah, okay, that we can take for fever. So I'm thinking like lowering your body temperature. No, you're shaking your head no. So there's really nothing else.
Besides, like I said, I haven't looked into like homeopathic options, and I know there are some like and there's things just like a cool washcloth and stuff. But
totally.
For if you're in a fever of like 104, 103, like those dangerous temperatures.
Yeah.
I don't know. I don't know the other options.
Yeah. Which there may not be.
There might, and that's a risk versus benefit situation. So then you need to take it. You take the lowest dose that lowers your fever, and that's what it is. You're doing what you can. Situations come up all the time. It's always risk versus benefit all the time. You have to still take care of mom and protect mom and do the best you can to minimize risk to the baby.
Totally.
But I feel like it's definitely not always an easy situation, and there may be other options, and we may find other options, that things are always developing. I
Yeah.
would be shocked if there's nothing that we could do that is safer that to lower that.
But
Yeah.
right now, like what has been the incentive? Because we find that acetaminophen is what is typically pushed.
Yeah. Yeah. And that's the risk though with that is then it's not just told, or pregnant women aren't just told, hey, if you have a high fever, call your physician. We'll figure out the lowest effective dose at that time. They're told, yeah, you have any pains or aches, take acetaminophen. You can take the max dose every day. That's the difference. And it's the conversations that are happening all over the world that are so different too. So moms are getting all different conversations around that. You may have a provider that's saying that's saying, hey, you don't want to be taking that if you don't have to absolutely need to. You try other things. And if you do develop that fever, then call us and we'll figure it out. They're just being told, hey, any pain, take it. So that just how we talk about it needs to change.
So for me, that's the beauty. I love the options. I love being able to find a provider that is aligned with you. So if you're someone who like is totally cool with Tylenol and you don't believe any of this stuff that's being said and you want a provider who's going to reassure you that you can take the max dose every day, I personally believe that you should have access to that provider. But on the
Mm-hmm.
opposite end of that spectrum, I believe that if that's not aligned with you, you should have access to a provider who is willing to say, like, okay, I hear you. I understand your fears and your concerns and your hesitancy. Let's talk about a couple of other things. Plus, I do want to share the line in the sand of where Tylenol might outweigh the risk of Tylenol use for the benefits of managing your fever. Let's talk about your
Mm-hmm.
comfort level with that. When should you call me? How will we move forward? Like, I love that we have a spectrum of providers and that the conversation varies, although it does lend its hand to how can you say there's a standard of care if there's actually no standard and every conversation is different, which I think that's the art of medicine. I don't actually think there's a standard of care. I don't believe in that term. I believe
Everyone
that,
practices differently.
yeah, exactly.
Yeah.
I believe the standard is individualized care. So the standard is how do I treat this human in front of me, considering what they are presenting to me right now with their signs and symptoms in conjunction with their health history, plus what their goals are and how we're going to get them there with the lowest dose possible of literally anything, the least invasive thing that we can do to get them the max benefits. Okay, you had mentioned earlier like toxins that we were exposed to, and you mentioned a few, glyphosate, which I've had on and glyphosate expert on the show to talk about where glyphosate shows up in our
Mm-hmm.
life. You talked about water. I had on a parasite expert to talk about how there are so many parasites in our water. There are prescription drugs in our city water because that's how many people dispose of them. You had talked about the things that are in vaccines. What are some other toxins that people need to be aware of that we're probably being exposed to? One thing that comes to my mind are like environmental toxins that are just in the air that we breathe every
Yeah.
day and we don't even think about it.
Yeah. And that's kind of how I got wrapped up in my aluminum research is because it is everywhere. So in your cookware, in your bakeware, most of those pans are aluminum. And so they'll say the coatings are toxin free and all those things. But that coating, I mean, a couple years, you scratch it wears off. It's aluminum that you're exposed to. Baking sheets, aluminum, like tinfoil. It's in our water. It's in our air. It's kind of everywhere. Yeah, that's what kind of got me really diving into aluminum because then I kept finding how these mechanisms apply and how they can cause the oxidative stress, the mitochondrial dysfunction, gut dysbiosis, and then the blood-brain barrier, permeability increasing, just things like that, where those are the things we see in these conditions. You just have to say, we have to minimize our risk to these things, or our
Mm.
exposure to these things. And so I'd love to see daily limits on multiple things for like aluminum or things that it's just added to. Because I don't know if you're familiar with the GRAS or generally recommended as safe that the FDA
Oh,
has.
yeah.
So you get substances or agents get into our foods as additives, basically as a loophole through GRAS through the FDA, where aluminum hasn't been reviewed since I think it's 1977 for safety. You know how
Wow.
these like thousands of studies have came up from 1977 to now, showing how dangerous it is, how harmful it can be. So it's like that needs to be looked at. Yeah, it's just having those limits. I think there's so much we could do for regulation, and to decrease our exposure. Obviously, the additives in foods, dyes, processed foods, and heavy metals in general, like lead's still present in certain areas of the U.S. You'll have different exposures. You'll have different. We have lead exposure in certain areas, or more of that. And so you can do like hair mineral tests to check for certain metals and certain toxins. So I almost feel like that should be like a gold standard for your child if they have any symptoms, actually maybe for even any child, to know what toxins they're showing. And then like, oh, this is in their body. Like that's not good. Like then how do we get them out?
Yeah.
And working on detox pathways. And I really feel like that's where we can move towards personalized medicine and functional medicine, which is addressing root causes and really looking at the whys. But it's the complications with that is because it's so individualized. Okay, so if you know someone's genetic variants, for instance, it can be super helpful because you can know or identify certain pathways that they may need support on. So like MTHFR, I don't know if you're familiar with that, but that's a very common variant. Like over 50% of people have it, but yet we're just now starting to talk about it. And it's like they can't convert to the active folate that their body needs for their cells to take in. And it's critical for functioning. And then we're giving synthetic folic acid. Okay, synthetic folic acid unmetabolized will build up and block that receptor for active folate to get into. And so we have enriched foods that have synthetic folic acid. So I feel like it just is like one thing after the other. Like it's so many things I see that we could do better. And then, if we're talking about neurodevelopmental disorders, that can have an impact. If you're in pregnancy and if your supplement has folic acid and not active folate, that could be a big difference, because if they have the MTHFR mutation, then they may not actually be getting the folate they need to support the fetus.
And that's for neural tube development.
Yeah. And that's why it was, I think, originally put in, is because, and neural tube, and so that's great. Like, it's great if it works to help those that don't have that mutation or that variant. Okay, but what about those that do? And if we know that it's over 50%, is it doing more? Is it being more helpful or causing more harm for those that we just haven't picked up on? Like, we know, yes, it's prevented certain neural tube defects, but what about those other things? Are we seeing like neurodevelopmental disorders? Is that a contributing factor to that, or other issues?
Yeah. So for someone who does take Tylenol for whatever reason, whether it's once or whether it is for general aches and pains and they're taking it often, should they be supplementing with glutathione to replenish their glutathione levels?
So I'm not going to give any medical advice, of course. For my research, it's N-acetylcysteine is the best, because glutathione, when you give it orally, it's a bioavailability, like the amount that gets absorbed is like 1%. It's not very much unless you do sublingual or liposomal or IV. But NAC has a better bioavailability, so it's like 9%. Okay, and so then that's the rate limiting step in making or synthesizing glutathione. But then NAC also has all these other potential benefits. And from all those studies I've reviewed, no one has side effects. There hasn't been any safety concerns with taking, because it's a natural supplement. It's what you need to make glutathione. And it's a direct antioxidant itself. So that's where I am at with thinking about that, about supporting detox and supporting your antioxidants, glutathione, with NAC. Now, if it's liposomal or sublingual or those methods, then yes, that could be, that's the direct, you're getting glutathione. So yes, that makes sense. But that's why I like NAC better.
Is NAC safe in pregnancy, or generally considered safe in pregnancy, or is this something that you would need to wait until postpartum to use?
That's like any supplements. I mean, you don't have clear regulations. I mean, even prenatals, you have to be careful because you don't know if you're getting what you're actually getting or what else is in there.
How
I
terrible is that?
mean,
Like, how
that's a
terrible is it that we can't even trust the prenatals that we are supposed to be getting, and that it takes like hours and hours of research to choose a proper
it
prenatal
does.
because you genuinely have to dig so deep to find out if you're ordering
Yeah,
from an honest and transparent company. That is so horrible.
yeah, it is. It is. And I hope, I mean, I think eventually there should be some more hopefully regulations on that, which there are companies that do testing, like additional testing. So like I like Full Script
Okay.
because it has a good reputation, it has carries products that they do testing on, and so you feel more comfortable about what you're getting and what's in them, also as far as like inactive ingredients, what they're making their products of. But yeah, so that's a whole nother thing too, is regulations there, and making sure that what you're taking is what you're actually taking to support your baby during pregnancy. But yeah, for the NAC, I mean, it's like anything. There's We can't say it's not going to cause any harm, but when it's a vitamin or a mineral that your body needs, or like an essential vitamin or mineral that your body actually doesn't make unless you get it from food or supplements, yeah, I mean, I would say it's fairly safe.
Yeah. Okay, now I have just one last question, and this is a personal question for you, but I think this episode's probably going to attract a lot of people that do have children on the spectrum. I'd love to what you feel like was the best therapy or modality of healing and support for your child. And maybe there are multiple. So for
Yeah,
listeners, I don't talk about this a lot, but
yeah.
before I was a doula, and while I was in early childhood, my specialty was actually ASD. And I did it for a
Oh,
number of years. And I did BCBA type support for parents. I am not a BCBA, but it was modeled after BCBA treatment. And that actually is what got me into early childhood. And so I know about like firsthand, literally firsthand. It's actually partly how the name HeHe stuck is because we
oh,
found that nonverbal children on the spectrum were able to say HeHe, and it was just so fun. There's so many children out there whose first words were HeHe because it is so simple, and I was seeing them so often, and it was just so special. So anyway, I know firsthand how much support families with a child on the spectrum need, but deeper than that, I have seen the transformations that these children can have and how it literally changes the lives of these families. So, for anyone out there listening that has a child on the spectrum and is kind of where you were a year ago at the beginning of your journey, and maybe they are feeling really dismissed by the healthcare providers that they are seeing, and maybe they do feel like the only thing that they are being told is like, add on this medication, add on this medication, let's add on this medication, let's put this medication for this side effect. And they just have this
mhm.
long laundry list of pharmaceuticals, and they are starting to feel like, okay, I don't know that we're headed down the right path. What
Yeah,
are the best therapies and modalities that you have found? And of course, it's for your son, but to open
right.
people's eyes to the options that are available out there is what I'm hoping to discuss here.
Yeah, and I will say we have tried probably most of the options. I mean, we've done
Okay.
OT, ABA, vision therapy, horse therapy, just speech pathology, or speech therapy. I mean, we've done probably most of the things that you would do as support. And and I don't want to say, so medications have their place,
Totally.
have their use, have their place. But in our society today, they're often just thrown at these kids because of behaviors, attention, all those things. And it can get out of control really quickly because when they're on this medication and then they have something else going on, or they have a side effect, and it's like, okay, now let's try this or address this. Or a lot of times with ADHD, there's anxiety present, and so it's okay, maybe we need to address the anxiety before the ADHD, so we're going to add on it, we're going to do an anti-anxiety medication and then do the ADHD medication. And there's just all these trials of like, you're doing this and then you're trying this. If they're on multiple medications and not doing well, that's a good indicator that maybe there's just a lot too much going on. And it's hard to even make any, you can't even make any good choices that way because you don't know what's doing what or what's helping. And so if you don't know if something's clearly having a benefit, then, it's a good idea to probably taper off of that and start fresh or minimize those so you can know what actually is helping or they're not on more medications than needed. Because if you don't pay attention, it can just escalate really quickly. So that's what I would say is just caution that. We've done a parenting class. We've done so many things. It's hard to say what the most help. So for us and this past year, the best thing that happened actually, which was a very hard situation, was our child couldn't be in, a public school anymore because of behaviors. And so he got sent to a behavior school, which I hate the term behavior school because it's really a support school. And so we actually transferred school districts to get him into the behavior school that we thought was best because they're not all the same. And that school is they're amazing. Like the staff there, they're so empathetic and compassionate, and they connect, like they work on connecting with these kids and saying, like, making sure they're safe here, because a lot of times these kids don't feel safe in school and they don't want to be there because they want to be at home. They don't feel comfortable, and so they just make them feel so welcome and safe, and they get to know them so that, hey, you need to talk to me, you come to me anytime. They're just like that. And I think these teachers have the hardest jobs and I completely get when they can't be in the classroom because it's distracting to other students. And then the special education teachers, what they're seeing every day and having to do for their job. They're just such good people. That made such a difference alone. So the school system that they are in public school, figuring that out is huge. And it can be, I almost feel like it's can be like a make or break decision too, because if they're in a school where they're not doing well and they don't want to be there, they don't for some reason feel comfortable with the staff, you're getting bullied or made fun of or anything like that can exacerbate the situation, then they can't even be they can't even learn. So the behaviors are number one. You have to figure out the behaviors. They have to be able to listen and stay focused and not be distracting. And yes, so if you can find a school and find support where they can learn the appropriate behaviors and they help them with that, they help them be respectful and responsible and learn safety and just having those things emphasized. Because yes, you do that at home, but it's different when it's in a different environment, and it's reinforcing when it's coming from other people. Because a lot of times they challenge you. When you're the parent, they're going to challenge you to the max. They're not going to necessarily listen. You're not necessarily going to make the progress that someone else could in that area. Yeah, so the school part, I think, is for us this past year, just making sure that was right and getting the appropriate support so that then we can focus on education and now closing that gap. Because you have to get those behaviors. Once they figure out that, and they have emotional control and regulation, then they can actually start learning and closing that gap. But yeah, and I think that's why I don't like when people say it's just genetic sometimes, because there's always a genetic component, but that's also to me an out or an excuse of saying that I can't help my child. When how can you possibly know if you haven't tried? It's like you're just you're almost giving up on them. And I'm not going to blame any parents like that. It's a hard situation, but I just encourage people to say, how do we know we can't have improvements by trying something? There's all these things we could try, and you just don't give up. If something doesn't work, you try something else. There's always something else you can be doing and trying. And I really encourage parents to focus on their self-care, because if you can't control your own emotions, it's going to be hard to ever teach a child to control their emotions. And with these kids especially, you just have to have patience and empathy and all those things. So yeah, and that's a lot of us didn't grow up with talking about emotions and things. So I think that's important too, is for parents to talk about those things and work on that themselves too. So it's a lot, but we're better human beings because of it, because of these experiences, as hard as they are, and they're hard. And it's so stressful that I don't wish that on other people, but it does. It makes your children make you better people, and your experiences make you a better person. And so you just learn and grow from it.
I love
Yeah.
that. Okay, I have 3 questions that I want to ask you, and
Okay.
I just want a simple yes or no, and I'm going to kind of trap you here in terms of like there's no nuance. I don't want any nuance. I just want yes or no, okay?
Okay.
And for listeners, obviously this is not my style. Every conversation has nuance, but I just have 3 questions that I want to hear your gut response, okay?
Okay.
You ready?
Ready?
Do you think vaccines cause autism?
No.
Do you think Tylenol causes autism?
No.
Do you think there's an ethical way that we can study medications in pregnancy?
Yes.
I love it. Oh my gosh. And for the record, you guys, those were all my same answers as well. I don't think that we have to be scared of vaccines or scared of Tylenol. I do think there are nuanced conversations. I think there are more studies that should be done. I think transparent conversations are the very bottom of the bare minimum that parents deserve from their healthcare providers. And I really am I wish you all that. I wish that you all had that. And I am encouraging you from the very bottom of the soles of my feet. I mean, it goes way beyond like my heart, but from the bottom of the soles of my feet, I am encouraging you. Fire providers who are not willing to have these conversations with you. As always, I'm going to recognize that healthcare deserts are absolutely a thing and very much present across our country. And I recognize that doing so may not be the easiest choice, but when it comes to your health care and your child's health care and your family's long-term health, you deserve a provider that is going to listen to you, is going to meet you where you're at, and is not going to push their own agenda or the system's agenda on you. They're genuinely going to trust you to make decisions for your family. And that's all I will say about that. Dr. Wachal,
Yeah.
this has been amazing. It's everything I wanted the episode to be and more.
Yes.
If people wanted to learn from you, hear more about your story, connect with you, how can they do that and where can they find you?
Yes, I think the best is Instagram. So your clinical pharmacist, Michaela Wachal. I know it's lengthy, but I think if you just type in your clinical pharmacist, I think it'll show up there. So that's the best way. I did have TikTok previously, but I got kicked off for talking about vaccines. So I did start kind of posting to get on there, but I focus more on Instagram just because of censorship, and I didn't want to mess with that. So yeah.
That's a whole nother conversation for a whole nother day is
Yeah.
censorship and Wild West. That is TikTok. All right, you guys, I told you in the opener, this was emergency use authorization episode. We brought it to you in a hurry because I know that so many of you are looking for transparent conversations. My inbox is literally filled, I am not kidding, with hundreds of questions. So
Oh
many
my
of
goodness.
you are nervous and you're scared and you're not being able to find the answers that you are looking for. And so I hope this episode gave you some reassurance. I hope it gave you some data. As always, everything will be linked in the show notes for you. We've got some research down there for you to check out on your own. You know how to get a hold of Dr. Wachal. Don't stop dropping comments and questions into my inbox, and I will see you guys in the next episode. By the way, I totally trust you to make the best decision for your family. I really do. No one might have told you that today, and you might be struggling to find a space that genuinely trusts you as a parent. And I want you to know you're in the right place. All right, you guys, follow Dr. Wachal on social media, and you can find me at Tranquility by HeHe and at the.birth.lounge. Until next time, head to your app store and download the Birth Lounge app for evidence-based childbirth education and data-driven postpartum support delivered straight to your phone. Bye. Thank you so much for tuning in today. I love hanging out with you, and it is an honor to be your go-to gal when it comes to preparing for your baby. If you've enjoyed today's episode, please leave a 5-star review and tell others why they should be listening to the Birth Lounge podcast too. You deserve to have a birth that you love with a provider that values your autonomy and respects informed consent without all the trauma that you so commonly hear about on social media. New episodes air every Wednesday and Friday. Hit that follow button so you never miss an episode. I'm HeHe, and this is the Birth Lounge Podcast.